Oh, hi there. I was hoping you could talk about COVID-19 exposure and transmission on public transit. How susceptible are people who are riding transit, and have there been any instances in BC?
Thank you very much for your question, and it's actually a common question, and there are very good safety protocols on BC Transit, and when we actually do contact tracing for COVID-19, we're looking at where people have been in the last 14 days, and so to specifically determine whether transmission has occurred on transit may not be possible, but we have some very good indication that it's not a major source of transmission. That indication is that to date, the vast majority of people in British Columbia, after some investigation, are able to identify where they were infected. So their source of infection is known. Most of us don't know who we're on transit with. And therefore, if we thought that places like transit and other areas where we have casual contacts with people were a major source of transmission, then the proportion of people who didn't know where they were infected would be much higher. I would also like to re-emphasize that we've also implemented some important safety protocols in public spaces, such as transit.
Do you have a follow-up, Jen?
Yes, please.
Sure, go ahead.
As you said, contact tracing can be difficult, and there are a lot of people coming and going, and it can be difficult to track. How confident can we be that transit is not a factor, and what would it take for there to be a public notification or an exposure outbreak declared? Like, what's the threshold?
Again, if there were an exposure, for example, on a transit such as a bus on which you are for several hours, there may be a public notification in a situation like that. But again, if you add up the summary of evidence, the totality of evidence about where transmission is occurring, it does not occur through casual contact, does not occur in places where people have safety protocols in place. And although there may be a notification, initially we had notifications, for example, for other forms of transit, such as airlines, but we are finding that those are not major sources of transmission. So we're focused on our contact tracing and our public notifications on situations and in places where transmission actually is occurring.